Hello, I'm Jonathan Nelson for the California Academy of Family Physicians with a special report on Medicare. The program provides health coverage for 43 million elderly and disabled Americans, some of whom may soon find it increasingly difficult to get the care they need. The Centers for Medicare and Medicaid Services have proposed a 15% cut in physician payments over the next 2 years. What's worse, the Medicare Board of Trustees projects that if the current payment formula isn't fixed, physician fees will be cut by about 5% each year until 2016. That's a 40% cut over 9 years. In a program that frequently doesn't pay physicians enough to cover the cost of the services they provide, these cuts will surely force physicians to reduce the number of Medicare patients they can afford to see.
The proposed 10% Medicare cuts that might come into effect with the sustained growth rate application really would be detrimental to family medicine and certainly to the health of this country.
Payment is the main issue, and if more and more doctors are refusing to take new Medicare patients or refusing to see Medi-Cal patients, the access for those patients is that much harder at a time when they already have inadequate access to primary care.
I know my colleagues in private practice are going to be limiting new Medicare patients to their practice, so that means more and more of them will come to me. Now, what does that do for us? It gives us an additional burden because these programs don't reimburse our costs. So we rely on donations from individuals and foundations in our community to help make us whole. And that's an increasingly difficult struggle when reimbursement continues to plummet.
When I retire, I think Medicare is going to be what I get to use. There won't be anybody buying me an insurance policy. And so it scares me to think that these cuts are going to go into play, and there may not be a younger physician out there that wants to take care of me when I'm older.
The proposed cuts are the result of a flawed payment formula designed to control Medicare spending and utilization by restricting payments to physicians. The Sustainable Growth Rate, or SGR, sets an annual spending target for physician services. If spending exceeds that target for the year, Medicare reduces payments to physicians to make up the difference. But cutting physician fees doesn't decrease patients' demand for services. And as the nation's aging baby boomers begin to enroll in the program, there's no question that demand is on the rise.
So many of our practices are working at a marginal level. So any cuts in reimbursement can have some significant adverse effects to the ability of a doc to be able to see those patients.
You have to be able to pay your staff. You have to be able to pay your electric bill. There are getting to be places, and I know there are places in California, Santa Rosa, where this is already beginning to happen, that if you're a new Medicare patient and you're calling around to find a physician, you can't find one.
Since most health plans base their fee schedules on Medicare rates, the projected cuts will drive down physician payments by private insurers as well.
This is a very important issue for practicing physicians. The reason being, Medicare payment essentially has become the pseudo benchmark of payment, and that's a very unfortunate thing.
Several recent studies have shown that in areas where primary care physicians provide the majority of care, Medicare patients receive higher quality care and better outcomes at a lower cost, potentially saving billions of dollars in the Medicare program. That's why your academy has met with the congressional delegation to recommend fixes to the SGR, is educating public opinion about proposed alternative payment systems, is encouraging the medical home, and is aggressively advocating for more representatives to the RVS Update Committee.
Just like with everything, if we don't get paid for the work we do, it's very hard to run a business. And so it's real important that we be involved to make sure that reimbursements are appropriate for the work we do so that we can stay in business and take care of our patients.
Family physicians have a unique perspective of what's important to their patients, and we need to hear that unique perspective.
We need input from our physicians. We need them to be involved in the political process, whether it is determining reimbursement rates for Medicare and the Medicaid programs, whether it's supporting the SCHIP Children's Health Insurance Program, whether it's finding the real challenge, a long-term solution to dealing with 47 million uninsured Americans. The American family will be better off if our family doctors are involved in these decisions.
For more on what your academy is doing for you, and to learn how you can get involved in the fight for family medicine, log on to the Academy's website at www.familydocs.org.
Online, find information on how to become a key contact and let your legislator know how Medicare cuts will affect you and your patients.
Reporting for the California Academy of Family Physicians, I'm Jonathan Nelson, and this has been your Academy in Action.